ICB toolkit, the local opportunity to integrate and build off the foundations within the community and primary care will be taken and will be moved forward. And I think that's a great opportunity to embed new ways of working in line with what the island needs and where we need to develop services in the future. So whilst we're talking about a national change, within that, there's local opportunities, I think, very much for primary care, community services and social care on the island. So I think we need to see that as an opportunity. And as Ros said, that's a framework we can build together in partnership. And I think that's something that this committee should receive updates on moving forward as well.
Thank you. Are you happy that we hand over now questions to the committee? Is that okay? Could I just start with that? I've been doing this a long time now, feels like forever to be fair. But having been involved when we had My Life of Full Life, that, you know, all these different things and changes that we've had and changes of boards and different names of things, this is huge because this is a 50% cut in running costs. And what's not being said is where the other 50%. So basically, this is a saving across, being quite a drastic, huge saving being made across health services that actually, from my point of view, and probably my residents' point of view, having seen services that have been cut to the bone, and even levels of management that have been really reduced, because every year that I've done this, I've just seen more and more savings having to be made. So a huge 50% in your running and your programming costs just seems an impossible task. And I know you're saying that it's not to affect services, but we've already got the outcry of what is happening to our Isle of Wight hospice. And I'm probably not as convinced and as positive as you are coming across. So I just wonder, where is the other 50% of the money going? Because this just doesn't feel quite right to me. So could you explain, please?
I think you'll recognise, Chair, we're operating within a national framework. So there's a level to what is in our control. I think what is in our control is what we can shape as a structure and process moving forward in line with the running cost reduction. Effectively, it'll mean a reduction in money spent on those services in the ICB. That money, therefore, will be savings that are realised nationally rather than locally. So I just think it's really important to note that context. This is challenging. We absolutely recognise the impact on local services, but we are operating within a national programme with a national expectation and a national target in relation to running cost reductions. So we are operating within the framework that we've set. Clearly within that, when we've looked at the future model, we have highlighted what we think are the risks and issues. We have highlighted where we believe we need to invest and grow. And I think one of the other challenges that all ICBs have nationally at the moment is that functions that will transfer over time may not happen immediately because some of the entities that are being referred to in the national guidance are not yet developed. So just to make that point, that this is a very much a nationally driven programme that we're operating within, and we're doing all we can to mitigate any impact locally and make sure we get the right structure in place in line with that national mandate moving forward.
Thank you, and I will hand over to the rest of the committee, I think, but my point is that actually, even this is of a national thing, this is 50% cut in an NHS that is already on its knees, and I've been part of watching all of these savings. So an NHS that has already looked at everything time and time again, and now to be told that there is a 50% reduction in your running costs, you know, this doesn't sound like the NHS is suddenly going to be funded better and work better. It feels the opposite to me. I will say we're trying to make sure that this committee is not run on a political basis. That's why the committee system is a lot better, that actually we have a very open conversation about it. But at the moment, it doesn't sit quite right with me. I'll hand over to the rest of the committee. Councillor Levy, you have a question.
Thank you, Chair. I think, because I had exactly the same thoughts reading this, and I guess we might not know more until we get more detail on this. And this might be an unfair question, but I kind of along the same thinking, I was kind of keen to understand where we feel the bulk of that saving might be. Is it from the transferring of some of these functions. And so if they're held elsewhere, then that would make up the bulk of the saving. However, said that, there are some pretty big things being transferred, which in itself, it makes me nervous about, okay, what will happen to those functions? So SEND, primary care operations, medicines optimization, that stuff, they don't feel like small things to be transferring. And so I guess it's hard for me to understand whether this is going to be a good thing in the long run, with the looming 50% saving to be made. So I kind of just wanted to understand a little bit better where we feel the bulk of that saving will be made. I don't know if that's an unfair question to ask at this point, but I'll ask it anyway.
I mean, Ros, you might want to come in. You come in first, and I'll respond on some of the specifics around things like primary care.
So I think we're absolutely clear this is a challenge. This is not an easy task, and this is about the running costs and not the service costs. And I think on the list of things that are in the paper, some of the services we are looking at where we'll transfer to and what the risks of that are and how do we mitigate them. Some of them are about doing things more efficiently and doing them at scale. So some of them are about doing things at scale. So we've got neighbouring integrated care boards, and can we do things together collectively and then at a more effective price? And can we do things more locally with other partners that could potentially make some efficiencies? So we are doing that at the moment. So we're looking at all those things, and some of the things we're absolutely doing collectively with. So I'll just use an example. At the moment, we're working with something with our public health colleagues about, how do we look at the needs of the population? How do we do that really once? And how do we utilize our collective skills to do that? So we're looking at things that we can do better, but I don't want to shy away from the challenge of this because the challenge is big. So I might just want to come on to James if you want to you've got examples of primary care.
Just before I do that, I think it's important to highlight that this links to the corporate costs of the ICB. So the number of people we've got delivering our services across Hampshire and the Isle of Wight. I think all parties involved in this absolutely recognise the need to make sure we continue to protect frontline services in that regard. So this is a corporate cost reduction. All parties want to mitigate impact on services. I think the last question clearly outlines that there is still some risk associated with that because of the services in scope. If we take primary care, the commissioning of end-to-end primary care pathways will still be retained within an ICB structure moving forward. So that's one of the services that will remain at the centre of the organisation moving forward. It's the same for dentistry, it's the same for community services, it's the same for other areas. So that core commissioning function will remain. I think what they've looked at nationally are those services that are slightly more operational. It might be estates, it might be digital, it might be data, that doesn't have to be run centrally, that could be run in a different location in the ICB. So if you think about what we were thinking around neighbourhood care before this guidance, we were looking very much about how we could deliver more innovative services in partnership with our primary care networks and with our community trusts. So some of those elements will move over time, but the core commissioning of those services that I've just mentioned will still be retained within the ICB. So there will still be that leadership and that resource around commissioning. It will look different, but we'll still have a handle on that locally, and that will help to make sure we continue to commission services in line with our population needs in those areas. And as Rod said earlier, population health is a key element to this and a key priority of this moving forward as well.
So in question to that, is could you explain because there are press here as well, so it's quite important that we're quite clear about our answers. There is lots saying that these changes are going to affect the funding for our hospice. If that's just running costs, could you just explain that a bit further to the committee?
Yes, so running costs is what we spend on our teams, if you like. So our corporate costs. It doesn't relate to the running costs of a particular service.
I'm going to hand over to Councillor Lever because he's definitely got a feeling on that.
I understand. It feels a little bit like semantics saying that though, because that's going to impact reducing that will impact the other, right? Though.
James, can you answer that? Is that okay?
To an extent, because clearly we'll have less people in the role potentially if we're reducing our running costs. But I just want to make the point, it is linked to corporate costs. The message nationally is this is about corporate costs and ICB running costs. Now, you're right to suggest that if we have a smaller team commissioning a service, that might mean that there's less people focused on that service and indirectly would have an impact. But I think it's important we make the distinction between corporate costs and running costs of other services in the health system, i.e. clinical services like the ones you mentioned.
Thank you. I have a question from Simon Bryant and then Joanna Smith, please.
I was just trying to work closely with both Ros and James, and just this is about the ICB and the almost like the back office bits rather than the other. And that's a very crude term, but for me, it's about understanding the ICB is our commissioning organisation we work very closely with. I work incredibly closely on many functions, and we're looking at how we can be more efficient in terms of population and public health. We haven't defined that, but we are really working closely. I'd probably meet Ros most days to talk about where we can join up.
And Joanna and then Laura.
Thank you. So I'm interested in the public involvement element of the ICB tool, blueprint. Within the ICB blueprint, it's heavily focused on public involvement, co-production, working with communities, getting feedback. And that's the same within the NHS England, working in partnership with people and communities guidance, which is a statutory guidance. And I'm just interested in how you plan to involve the local community on the island in any commissioning decisions going forward. Because
I
think this could be, you know, that we've been inundated with people concerned about Mountbatten funding, and I appreciate that's a commissioning decision and it's not related to the ICB cuts. But I would urge you, if there are any commissioning decisions that are going to impact services for Isle of Wight residents, that you must engage with them. One, you have a statutory duty to do so, and two, because you'll only get the right service if you listen to people in the local communities. And as well as that, you need to get communication right with local people, because without communication, nobody knows what's going on. They don't understand the rationale behind your decisions. So communication will be key as well.
Yeah, so Joanna, you know I support that because we've had many conversations in the past around dentistry. So it's something that I absolutely encourage and I drive in services I'm responsible for. Public involvement remains a key function. You're right, it's a statutory duty. No one's moving away from that. I'm more glass half full on this. I think if anything in the new model, public engagement and involvement will be much closer to how we commission and how we plan services in the future. And I signal neighbourhood working as a real opportunity in that regard. And if anything, I think public involvement will have to be embedded even more into our commissioning moving forward. So without wanting to go into the specifics of the toolkit and the particular line in the description, we're really clear in our future planning for the organisation that public involvement and engagement remains a key strand. And I think the opportunity that this brings, well, whilst we are talking about a national programme, I believe the opportunity this brings is to bring public engagement and involvement a lot closer to service delivery when we start to talk about neighbourhood health as a function moving forward. So I hope that reassures you, and we want to continue in the same vein moving forward. I think your point around communication as well is well made. I mean, clearly you've referenced the point around the hospice and other services as well. And I think where it's worked well on the island is where we've engaged early, where we developed a plan and where we developed a narrative. So that's not going to change. Wherever we end up in the future, that's still a priority that we stand by.
Laura and then Sarah.
Thank you, Chair. For me, it's more a point of clarification, if I may. My understanding is that the ICB blueprint remains in draft and
Yeah.
is subject to further consultations, and that our local ICB has made representations and submitted a draft plan. I'd like to know when that draft plan can be shared with other stakeholders, with partners such as Adult Social Care and the Isle of Wight Council, and who is responsible for approving that plan and the time frame within which that approval may come forward. From a local authority point of view, and specifically in relation to adult social care, I know James and Ros, we've had many discussions about my personal concerns and my professional concerns. I'm the statutory officer responsible for adult social care on the island. And for me, the list of areas where the ICB will be divesting itself of its responsibilities stand to potentially increase the local authorities' demand. What we could see is pressure being brought to bear on adult social care budgets as a result of unintended consequence of some of the decisions that are made, if those decisions aren't made in partnership.
Yeah, and as you know, this is a national decision. I think other ICBs are flagging the same risks. We are waiting for NHSE to sign off our plans. So you're right to say it's been submitted. They need to give feedback. We're then hoping for national clarity in terms of what the next steps are and what the process of engagement is as well. So you'll understand we have to operate within that framework. When we are able to share, we will of course share, and more than share, we need to consult and understand impact. And that's not just about how we move forward, but I think that sort of, sharing of concerns and sharing of intel on impact is really important for all of us in determining the right way forward. But I will stress again, in some regards, this is out of our control because it's a national programme. We are dependent on that guidance. We are dependent on their timelines, and we are dependent on their direction in terms of what can be shared where. Ros, I don't know if you want to add to that in terms of how we move it forward.
I just think the only additional thing which, Laura, you are also involved in is that of those services that particularly those ones that are looking to potentially transfer elsewhere, we've set up a number of groups with local authority colleagues, so with Laura and Simon and Ashley Whitaker, to look at what the model might be, what the timelines might be, what any opportunities are, what risks are, and what unintended consequences there are. So those are the purposes of setting up those working groups over the next few weeks, so that we really do that together, because we know we have to do that together for precisely the reason that you're saying, Laura. We just have to really be aware of any unintended consequences and the risks of that and how we mitigate it.
Thank you, Sarah.
Thank you, Chair. I was pleased to hear that you are keen to involve communities through neighbourhood care and decision making over commissioning and being involved in that process. I was wondering if you could give some sort of practical examples of what that might look like, if you can sort of say at this stage. And on the back of that, what that looked like for the decision over the Mountbatten commissioning. What was the involvement with communities? What's the getting feedback from people? How did that work for that decision, and how might it be different going forward?
So I'll pick up, Sarah, thank you. I'll pick up the neighbourhood point first. So what we are currently doing with neighbourhoods is we met with all of our GP practices across Hampshire and the Isle of Wight last Wednesday, and we've now launched a locally enhanced service, which is about clinical models such as proactive care, home visiting and same-day access. So we've created the commissioning framework for neighbourhood care, and we're now having conversations with our practices and PCNs on the island in terms of how will we deliver the model within that framework, how do we involve other partners. Once we're clear on that operating model and how we move forward this year and next year, and as Ros said, one of the key conversations tomorrow is with local authority colleagues in terms of how they want to align and partner moving forward. I think that then gives us a great opportunity by which we can engage with our community around our future model of care and sort of moving it forward. Joanna will know, because Joanna's involved in the health watches across Hampshire and the Isle of Wight. We're really keen for the health watches to support with the public engagement and the evaluation of integrated working moving forward. So starting from a fresh page, if you like, we've put the investment in place, we're shaping the model clinically. We then would like to engage with our community around what that means, and then use our community organisations to drive the evaluation of that moving forward.
Thank you, James. Just to touch back on the decision over Mountbatten, it seems like that decision has already been made, and then there's going to be consultation with communities. It seems like that's quite a big decision to happen ahead of having that engagement with the community. Am I understanding that right?
So yeah, and I'm picking up. So you're aware of my role, Sarah, and what I've done previously. I am picking up the issue with Mountbatten. So what I can say on that is that we've absolutely heard the feedback, and we've been in dialogue with the hospice. I visited the hospice and met with myself and the organisation's, the ICB's chief financial officer, met with the hospice on Monday, the chief exec and the deputy chief exec, and we had what I thought was a really open, honest and constructive conversation around the potential impact of these changes, the entirety of the service that the hospice offer, what the opportunities are moving forward. And what we have done following Monday is agree a number of key lines of inquiry in a series of meetings over the next couple of weeks to start to understand these issues in more detail and start to have conversations in terms of future direction. So I get the frustration in terms of previous consultation. I absolutely get the concern of residents in terms of how these decisions have come to pass. What I can give is my absolute commitment for me and my colleagues to work with the hospice now, understand the impact, and we've agreed a path of meetings over the next couple of weeks. So we're hoping that over the next couple of weeks, as we get to the point we get to, we clearly update stakeholders, and then that will determine how we engage moving forward and what that means for provision in the future.
Thank you. Any other questions from anybody else on the committee? No? I just need to check with the committee that we have here that to note the report or to put forward any recommendations based upon the information heard at the meeting. I do think as a committee we should note our concern that this is a huge change. Having seen all these discussions on reduction of running costs and things like that, this seems to be a change that's being brought forward really quickly. You know, when you've looked at reducing running costs and ICB and the changes and all of that over the years, this does seem a huge pressure on the ICB to do this on what does feel like a really tight timescale. So could we just have a show of hands? Is the committee okay to say that we note the report, but we also would like it noted that we have quite grave concerns that it's a huge financial reduction in a very short timescale, and although that this is reducing running costs, we as a committee cannot see how ultimately it will not affect services. With that, could we have a show of hands if we're happy with that recommendation? Thank you. Thank you ever so much for your time. I'm sure we will see you again, because this is now the first part of the meeting, which is like the old health scrutiny meeting. We are a decision-making board, but we will make sure that we keep asking you along, and we will treat you as gently as possible. Hopefully you will understand that and want to come back and talk to us again.
Yeah, and sorry,
else you would like to add?
only to say sorry we can't be there in person. We prefer to be there in person, and often we are, but clearly the issues with travelling today. I'm conscious the island's very busy, but look forward to seeing you in person next time. And as always, if there's ever any queries and questions between committees, please give them to us and we'll try and deal with them in a timely manner.
Yeah, thank you. That just brings me one thing before you go. We have had another councillor, a member's question, and it was the committee should consider adding a note to the introduction or summary of the papers to identify the individuals or mechanisms for the Isle of Wight Council representation on the respected external boards. This would assist members should they wish to obtain further information or clarification in advance of committee meetings. I think at the moment going forward, so the committee are aware, it will be really useful if you do have questions when you've read a paper, if you send them to me as the chair and use that group email that we've got, then we're keeping each other in the loop. I think that's a much more constructive way, and as a committee, that shows that we're working together. If we need to find and say, for example, Councillor Hendry wants a specific question from someone like James Roach, then you put the question onto that email site. We will then ask the question of Mr. Roach, and then we can actually get that response back to everybody. So it means we're all informed, if that's okay. Would that work for everybody? We will find our feet, I'm sure, and quickly. Thank you ever so much for your time, and we look forward to soon. And I don't envy you, a very daunting task in front of you. Thank you.
Thank you.
So I'm going to have a little, is everybody happy if we slightly change the agenda? I am aware that Simon Bryant has struggled through the traffic and is here, but I would quite like his part, which is on the decision part of the agenda on D, primary health care services. Would you be happy if we bring that forward to be the next point of discussion? Is everybody happy with that? And then you'll be able to leave afterwards. You are most welcome to stay for the rest of the meeting if you want. You just can't vote, Joanna, entirely up to you. Yeah, next time you're most welcome to stay for the whole of the meeting. We do value your input. Thank you. I'm going to, is everybody happy with that? And I will hand over to Simon Bryant to introduce primary health, public health primary care services. In your papers, that's pages 181 to 282, and I am assuming you have all read the papers.
Many thanks, Chair. I'll be fairly brief, as you say, you read the paper. So the purpose of this paper is to approve spend in respect to public health primary care services. Those are long-action reversible contraception and the NHS health check. So they are services that are within the remit of public health, but are delivered by our primary care colleagues. So in GP practices, they are the only provider that are available to deliver that due to various clinical and patient registration requirements. So we are proposing to spend just over £2 million over 7 years. Of course, if things change, we have break clauses in the contract and we can always give notice, but we work very well with our primary care colleagues. As you can see, I work with James and Ros closely. So the request of the committee is to agree that spend. It's within the public health ring fence grant, which is what its purpose is. And as you can realise, there is a change of leadership for public health. I have discussed this with the incoming Director of Public Health, and she is very satisfied that this is the right approach. But at this point in time, it is me as Director of Public Health advising this committee in that role. Councillor Mosdale, is that brief enough for some more?
That's fine. Is everybody happy? So this is why this decision, this is the type of thing that would have come to a cabinet member in the past to have been discussed and to have said that they are happy with it. So it's really important that, you know, you do try and give some input into this paper. Can I hand over to the committee for any questions? Any questions at all? If there are no questions, then I'm going to go to the recommendation, which will be that the committee approves spend in respect to public health primary care services up to a maximum value of £2,461,881 over 7 years. With my little calculator, that works out about 351,000 a year, doesn't it? Contract to be let for an initial period from the 1st of April 2026 up until the 31st of March 2031, with the option to extend this period by a further period of up to 2 years. Is everybody happy that that is the recommendation and move forward? Councillor Redbrup's got a question.
Sorry, I just have one question just for clarification. In terms of the long-acting reversible contraception, you said that this was only what the primary care people can deliver. So is this separate to a budget for the sexual health clinic at the hospital? Is that right?
Yes, so this is just the primary care element, so GP practices. What we know is we need to make long-acting reversible contraception as accessible as possible. And I should have said what we are really trying to do is increase that access. So that requires clinicians to be trained, and there is a we need more. So we are providing training,
Yeah.
so more people can be trained to deliver it. Therefore, within this budget, we have added a growth factor because we expect to see more delivered in primary care, which is much more convenient, much more accessible. We also monitor quality, so we don't want somebody to change their mind. So there's a lot of kind of consultation going on. So we monitor removals within a year, because that shows actually that something may need, people change their mind, and that's fine, but we want to keep it as high quality as possible.
One follow-up question. I appreciate you might not. I appreciate you may not know the answer to this, but I thought I'd just ask while you're in the room. Does this budget include and the training? Do you specify the training or requirements there are, or is that something that's set elsewhere? This is just about the budget. Because my question is about in GP practices, if they have access to administering local anaesthetic in terms of IUD fittings. I know that's not necessarily something that is done every single time, but some people may request. I don't know if it happens within the primary care setting or not. I appreciate you might not know the answer.
I think that was two questions. So yes, the money is for the whole programme. We may put some additional funding in from the public health grant around training, could be a small amount, and we would do that. The funding for the LARC is based on a tariff for fitting a LARC, so that price, so that would cover the costs of whatever the GP needs to do. Now, as you say, some may need a little bit more time or anaesthetics, so that would be covered in that way, but we don't specify that. It is slightly complicated because you can have a LARC for different reasons, for medical reasons, for heavy menstrual bleeding. That's covered by the ICB colleagues. We work really closely in tandem, so they fund that bit at the price. So we work together, but we fund this bit because it's a public health remit to do that.
Do we have any further questions? Are we happy to move forward to the vote on the recommendation as per page 182? We have a show of hands. Is everybody happy? Oh, second it. Councillor Redrock, can you second it? Can we have a show of hands, please? Councillor Gladwin.
Just wondering what the basis of this report actually was and why it was seen as a public health requirement.
So these are mandated services for public health, and we need to commission them because of the way that the public health function works within the council, and also we don't deliver that. So for example, my colleague Laura delivers a lot of services actually self, so that's a different way. But because we are commissioning, we need to spend a lot of money at once, and therefore it's right that that committee has a view of how we spend that money. It is it's very standard, and we've done this for many, many years. And there was a question from procurement, do we need to come here? Because it's a regular thing, but I felt it's a lot of money. So it's really important that we come here. But as Laura has just pointed out to me, I've asked permission to procure, but I need to award. So I wonder, Chair, if you would be willing to delegate that to the Director of Public Health to award the contract after we do that together. Would that be okay to make that amendment? And apologies for making that mistake.
Councillor Gavin, so you're aware the Public Health Department commissioned a lot of services. You'll see lots of this coming in front of you. So things like the 0 to 19 service, sexual health services, the contract at the hospital, it's all commissioned and the funding goes via public health. So they will commission those contracts on sometimes 5 to 7 years. So that you will see some major contracts coming in front of you for this committee to make a decision, whereas a cabinet member would have made that decision in the past. So that's why this is coming to this committee. So I think as per the recommendation, we'd be happy to do that, that we move forward, that you can actually go with this and work forward with the procurement process.
Megan, if we can say delegate to us, sorry, the Director of Health, that will cover that. Okay.
Chair, if I could just quickly, thank you. You have a resolution that you've took the hands, and we've tallied the votes. So if you were minded to note that motion was carried as per the recommendation, that would move you nicely on to the next item of business as you choose. And that would just conclude the vote on that item.
Yes, absolutely. So we'll note that motion has been carried. Okay. Enjoy your trip home. I hope you don't get stuck into traffic. Thank you for coming.
I think the bike will be all right.
Thank you. So if we can now move to item A of decisions, which is the White Care Transformation Update, which is 11 to 16, and I will hand over to Laura Gordon.
Thank you, Chair. My assumption is that committee members have had the opportunity to review the paper, and I feel like a little bit of a fraud bringing this paper before you today. This matter was previously considered by the Scrutiny Committee only 3 months ago. So the information you're receiving is the same as the information sent to the Scrutiny Committee that was interrogated at that point in time, and is being shared with you for information only. No decision is required. It is purely for noting in terms of the current position.
Councillor Redrup, can you just confirm that, because you were the chair of that committee?
Yes, that's true.
Thank you. So the recommendation for this paper is, assuming that everyone has read the papers, does anybody have any questions before we move forward to the recommendation? I can have a comment, can't I, as chair? Councillor Adams.
Yeah. It's actually sent in by Councillor Jarman, but I think it's relevant. Discussing it upstairs with White Care have done very good in this, but comments been passed that the paper skirts around the performance of the transformation and avoids the clarification that White Care has failed to meet the fiscal objective, the result that there remains an ongoing requirement of cross-funding by the Isle of Wight Council to cover the fiscal gap, £210,000. Yeah, I noticed that that used to be £550,000. So that makes it look a lot more respectable. What's being done to reduce that figure so there's no liability to the Isle of Wight Council? Anything?
Could you, before you answer that question, there's a reason why I didn't put this forward this evening, and it's some of the things that went through with the adult social care scrutiny, is when there are some services within this council that I know we like to look at ourselves and make things look like a business. But when you are balancing up services with actually what it prevents and what can happen, it's very hard to say to a service such as White Care, which an awful lot of island residents do use, that you have to close that fiscal element completely, when actually there is, and this is what we're meant to be doing, is this committee. We discuss these decisions, isn't it? Exactly what we should be doing. So my view would be, having been a cabinet member in the past, that this is such a desperately important service. What we don't want to do is price it out of a region that people can't afford to have it, because the prevention cost of it and what it says to adult social care, if someone has a fall, the longer they are left on the ground, the more likely they're going to end up in hospital. White Care is one of the few services that will act on the island that when someone presses that button, they will go out. We see a lot of cheaper services being advertised online, etc. But all they will do is call a member of the family, etc., to go and deal with that issue. They don't have that capability of actually sending somebody out to pick up things like that. So it's a really valid question, and I think it's really good because it's opened up those questions here. But my view has always been that we can't completely close up. We have to, in some way, ensure that White Care does not become completely unaffordable for people where it is such a preventative service. Over the years, there is so much that I've had put in front of me, and I'm sure we will as a committee over the next year and then the next continuing years, that you're going to have to make some quite tough decisions on what is that prevention element. what is that service doing, and can people do it as well? So I was going to get this put in writing, the answer to this.
Yeah, I agree with all you've said there. And personally, councillor, it's no problem for me if the Isle of Wight Council. I've just experienced after a friend of ours for the last 18 months, paying them away last Monday, and White Care, all things with them, tablets, and in general, they were good. Mountbatten come in for the end of life care. Mountbatten was absolutely fantastic. We really have to look at this situation with Mountbatten. Why I've raised this is because what concerns me is, getting back to the first part of the meeting, was when we're talking about the statutory, offloading the statutory duty further down the line. I'm just concerned, Claire, that none of us know what that involves. And my worry is, like you say, that reduction, that 50% reduction is a lot. It's a huge sum. And do we know where we're intending to offload these responsibilities, these statutory duties?
So I have to say, this is the first part of the committee meeting I felt quite refreshing, because actually now we're doing what we're meant to be doing as a committee. Is we're not just meant to be getting our officers to answer these questions. We're meant to be having this discussion as a cross-party committee where we discuss and get under the skin of things. That's what we're meant to be doing, not just reading reports and saying, oh, that's fine or whatever. So your questions, I think, are the first ones, not the questions that came from here, but the questions, I'm very sorry to hear about your neighbour, but your questioning is now exactly what we should all be doing as committee members. We need to act like cabinet members and get under the skin of things and think, well, what is the repercussions of this? Is that interlinking? Councillor Lever and I were very clear from the very beginning when they were starting to talk about the ICB that a 50% reduction in such a quick,
It's major.
it's major. I don't feel that we dug enough into that in that first part of, and hopefully when we found our feet and have the next committee meeting, we will all be saying, well, how is this going to affect our residents? This is why we're sat here. It's to question, why is this being done? How's it going to affect us? Yes, White Care, hospice, all of these services on a small island are all completely interlinked, and it's our duty as a committee to get, how is this interlinked? Is this right? And I feel that we're actually got somewhere with this part of the meeting to discussing, well, what we're saying about White Care is, yes, we agree it, but it's opened up a line of discussion that I think is really important. Councillor Gladwin, then Councillor Leave.
I was just thinking that with the White Care service, it's not really that well advertised. Maybe that's something we should be thinking about. And then if you advertise it more and you get more people using the service, then maybe the costs will reduce for the individual user as well. So maybe we should be thinking along those lines where we're expecting it to be more self-funding.
I pass that question to Laura Gordian.
Thank you, Chair. If I may, I'd like to come back to respond to Councillor Adams first, and then to Councillor Gladwin. In relation to the really brilliant question Councillor Adam raised, I think there's 3 points I'd like to make. The first is thank you. It gives me the opportunity to highlight the work that my excellent team have done to reduce the cross-subsidy across my department by 62% to date. They've come from a standing start, an awful lot of work, of effort and of commitment has gone into transforming that service so that we now have something that is not only fit for purpose, but responding to 97% of their contacts within the first 60 seconds of that contact. It is a flagship service that is truly helping island residents, and that's testament to the team. I think the point I'd really like to make is that White Care is the Isle of Wight Council. We're not subsidising a standalone business. It is a department within my directorate. They're my staff delivering my services in the same way that social workers are, the community equipment services, our deputyship team are. They provide a different type of service in the same way as our own care homes do and our own home care agencies. So whilst we're looking to make them self-funding in terms of generating enough income that they don't require revenue to be allocated from council budgets. As a council service, the council budget is absolutely there to support delivery. White Care for us is not part of our statutory duties. There is no legal requirement for us to deliver that service. It was developed, gosh, I suppose nearly 40 years ago now, to support island residents in a way that they didn't have support before. As we know, many of our folk locally move here and no longer have close ties with their families who sometimes live on the mainland. By having a service that's able to respond in their hour of need, in the moment they fall in their kitchen whilst they're getting their ice cream out of their freezer in this weather, or the minute that they slip out of their chair when they've reached down to put their slippers on, is something that those folk don't have. So as well as being part of the council, the service it provides is hugely beneficial. The work that they do prevents pressures on other parts of our system, and we've recently piloted a service, it is referenced within the report, with the ambulance service. If an ambulance is called to a 999 call and the person has had what they call a long lie, they've fallen and been on the floor for a period of time, the ambulance crew must convey that person to hospital. When they get to hospital, they're presented at the emergency department. And as we all know, our emergency department here on the island struggles to keep up with the needs of people locally on multiple occasions. The pilot we put in place enabled the ambulance service to make direct contact with White Care staff so that our staff, the council staff, attended instead of an ambulance crew. Where there was no clinical need to dispatch an ambulance crew, our staff were able to step in, save that person from lying on the floor for a long period of time, support them back into their chair, back into their bed, wherever it was they needed to be, make them a cup of tea, check they were comfortable, link in with their family and ensure that they were safe. Not only did that save that person from experiencing what could only be a traumatic event for them, it saved additional costs to our wider health system in deploying an ambulance, potential attendance in the emergency department and potential admission. That's a service that was recognised nationally as being a model of good practice, and that has generated income for White Care. It's been funded by our health partners. It's something we're really looking forward to continuing as time goes on. So in terms of White Care's trajectory, you'll see from the report, although the subsidisation, the spend from council budget currently sits at 210,000. It's anticipated that will reduce by a further £100,000 in this financial year. The intention is to further reduce that through additional marketing events. And this brings me to Councillor Gladwin's question. You'll see in the report that part of our original plan was to recruit somebody to support us with marketing our internal services, not limited to White Care, including our carer support offer, our respite offer at both the Adelaide and the Gouldings, and our internal services providing home care. We're looking to recruit an individual to really lead on modernising those services in terms of how we advertise them and how we attract customers. That post is currently in the process of being advertised, and we're hoping it will go out to advert within the next couple of weeks, and we're really excited to see who we can capture in terms of unique island talent to support us driving forward that enhanced opportunity to attract people to the service. With more people coming into the service, we'd hope that the ability to generate income to cover cost, not profit, it's all about covering cost, would increase, which should hopefully see that last £100,000 being accommodated over the next 2 to 3 years. The purpose of this report was really to draw to your attention that this piece of work isn't anything special now. Our transformation programme has become business as usual. The team have embedded the activities that are required to drive forward, closing that gap and mitigating the demand on local authority budget for that service as part of what they do every day. And for that, I'm truly grateful to them. They're a unique bunch of people who are incredibly talented, who are hugely committed to island residents and who do a brilliant job every single day of the week.
Thank you, Laura. There were two questions that came. I did say at the very beginning that Councillor Jarman had put some members' questions in. There was two questions relating to this paper that I said that I would ask if that was okay. On page 15, accessibility and integration. The paper is unclear on how, this is from Councillor Jarman, the paper is unclear on how the advances in digitalisation are deliver service benefits. Likewise, on the integration with the change programme in preparation of the imminent closure of analogue telephony. Further on integration with the continued deployment of the NHS app and its service enhancements. The committee should consider how digital investments by NHS OpenRoute and other care providers could be integrated into the White Care service and to leverage those third-party investments to enhance White Care services and reduce costs. That's the first question. Could you?
The analog digital transfer has been something that's kept me awake at night. By switching off a sudden part of a service, it causes me to have the collywobbles, I guess. That's a lot of vulnerable people who perhaps don't have digital access. We've been working with our partners, service providers, to ensure that all of the people who have only a 2G connection, which is the part that's going to be turned off, are able to transfer on to new services. I'm delighted to give the committee some very hot off the press news. I only received it myself on Tuesday. Those tests were successful. We now know that the transfer from analog to digital will not impact our White Care customers in any way. So that piece of work has been done. In terms of wider digital integration, White Care is a service that has a TSA accreditation. What that is basically a governing body who say it's up to standard or it's not up to standard. As part of that, innovation is one of the key areas where the service is evaluated. White Care is quite a traditional service based on the needs of the people it supports, but opportunities are always considered in terms of expanding that service. Our White Care team are currently supporting people with dementia living in our community who otherwise would have been living in residential care homes through new developments such as geofencing. So the advancements in technology enables us in effect to put a theoretical boundary around a person who walks with a purpose known only to them. As soon as they move outside of that digital boundary, White Care are notified, and White Care are then able to make contact with the individual or with their family member to see whether that person needs support or whether this is usual activity or how that interaction needs to be managed. If it's something that's unusual, one of our team will go out, they'll meet up with that person who's walking with a purpose known only to them and support them back to their home, keeping them safe in the interim. So lots of different advancements as they're coming online are being explored by the team. And certainly that geofencing has proved to be incredibly valuable to local people and their families to date.
Thank you. Before I ask the other question that Councillor Jarman had, Councillor Lever, then Councillor Hendry.
Thank you, Chair. Firstly, I'd just like to comment on, for all the reasons Laura had mentioned before, I think it's right that we kind of get out of this mindset that just because the council's spending money that's inherently a bad thing. Some of these preventative services are absolutely critical, and I think it should be commended that we've 62% reduction. That's massive, and that's really good. Two things I just wanted to ask further about was reading about the marketing. I think that's a good thing. I was looking at the council webpage for White Care, and it didn't express an awful lot about White Care, so I think that's absolutely yeah. I wasn't going to say that, but yeah, I think that's absolutely an area where we can look into expanding that. My question was around the marketing role. About, is there anything being done to try and look at changing the role or changing the offering to try and make it more attractive? Is there anything happening there? And the second point of what I wanted to look into was a couple of the bullet points here around risk seems to come down to outsourcing, and so obviously new to this, it'd be good to, perhaps not tonight, but have a conversation around when we look to outsource services, and actually is it, or it doesn't quite seem worth it a lot of the time. So talking about the right time to do that and when not to do that, and how we can learn from the risks that are here, that'd be great. Thank you.
In relation to outsourcing, I use a different word, because for me outsourcing is taking a council service and asking somebody else to run it. That was a proposal back in 2022 that was considered and was rejected, and it was determined that maintaining White Care as a council service was really important, not only to the council but to local people. What we do is occasionally contract out elements of that service, and for us, where we found it difficult to recruit staff, for example, to answer out of hours calls overnight, we were looking to partner with another organisation who already had that in existence, who could pick up our calls as well, which would save us having to struggle to recruit to those posts. that fell apart. And the impact of that led to a revisit of that element of the decision. We can only make decisions based on the best information available to us at the time. And I don't think there's anything wrong with revisiting those decisions when new information becomes available. And that's what we did in relation to that call handling function. It was determined as part of that review that whilst it was more expensive to maintain local staff, local presence and a local out of hours service, it resulted in a better level of service for our customers. And for that reason, we fell behind profile in delivering the element of income generation that we were hoping to deliver. I believe that's still the right decision for Whitecare and for local residents, and that's enabled us to grow our team. What we have now is a core of incredibly skilled call handlers who answer the phone and are able to talk to people and support them until help arrives if that's what they need. So I think that contracting out element is an area we've learned certainly quite a bit with Whitecare over the last 2 years. And that lesson learned has impacted on other areas of our business as well. So really good transfer of knowledge in that space. In relation to the marketing role, it's the first time we've advertised, and we've been really heavily reliant on our HR colleagues for guidance around how best to do that. It's a really novel role for this authority. As far as we know, we've never done it before, and it's going to be quite a steep learning curve for us. So we're hopeful that we can attract the right candidate to that post. We will engage with them around our offer, and we're hoping that they'll engage with our local communities so that we can identify where that offer doesn't meet need. And if that offer doesn't meet need, that's the time at which we need to review what we're offering and how we're offering it. I think the challenge with Whitecare and our customer base is people don't know what we do, as Councillor Gladwin said. Our offer is broad. We offer things from a simple phone call to check in on you twice a week if you're lonely, to geofencing, to a full falls detection package. So you don't even need to press your buzzer. Your watch will tell us if you suddenly change altitude, I guess. So lots of different offerings there that we need to explore and we need to promote more widely to our community. Ultimately, what it enables us to do is help people to maintain their independence. I'm yet to go into somebody's home, and I've now close on my decade in adult social care, and them say to me, Laura, what I really want to do is move to residential care. Everyone says to me, Laura, what I really want to do is stay in my own home for as long as possible. Whitecare help people to do that. And they help people to do that with dignity, treating them with respect and helping them to maintain their local connections, which is hugely important.
Councillor Hendry.
Thank you, Chair. Thank you for the report. I read it, didn't have any questions. But then, as you've been speaking, I've learnt more in the last 10, 15 minutes about what Whitecare does than I have done in the report. And my concern as a committee, a lot of us are new to this, how do we upskill the councillors so we can ask the questions we need to ask and find out what we do as a council? Because Whitecare, I knew very little, I know more now. I want to know even more going forward. So what can we do as a group to bring our, well, upskill us really?
I like to think I'm an incredibly open and receptive person, and you all received invitations to our big picnic with people who access our services yesterday. You've all received an invitation to the Adult Social Care Conference, which is taking place on the 11th of July. An open invitation to all members of the committee. If there are areas you hear about that you want to know more about, please just get in touch, and I'd be really happy to rotor you on for a shift with Whitecare to enable you to access one of our care homes so that you can see what they're doing there, to go out for a day with a social worker. It takes a bit of planning because ultimately we're talking about incredibly personal things for people who live in our community, and we need to ensure that they consent to you being there and being involved. But I don't see that as a barrier to enabling that to happen. I'd welcome any engagement from committee and from wider councillors in any of the adult social care business.
Thank you. And Megan's just whispered in my ear that we are going to a committee development plan, which will be something that we build as we go along. So I think she's quickly noted that actually it'd be really useful for us to actually go and see Whitecare, you know, and see those services. When I was, that's the one thing about the committee system. When you're a cabinet member, you can. When I was the cabinet member years ago, I went around every single care home. You know, it took a lot of time, but I went to every care home that dealt with learning disabilities. I went literally everywhere. So what we do need to do is work on a committee plan and then work as a committee. What is really important that we see? There are some services that, you know, we probably don't want to see in our lifetime, but actually as a committee, we need to have a level of understanding about. So I think this will go down as one of the first things we put on what we're going to have is how do we develop our, I think it's a really good question, Stephen, Councillor Hendry, to bring that, what we're going to put on our work plan. And what I will do is I'll send out an email tomorrow to say, having had our first meeting, what do you think we need to upskill ourselves to put on the committee development work plan, so we have a really good understanding, because this is such an important committee. I can't keep stressing it, and it is going to make some serious decisions. The you know, look, and Laura Gordian and I at the very beginning actually agreed that this is quite a light agenda because we need to work forward with the right sort of items to come forward, but you're going to have some real meaty things you're going to have to discuss, and it does need to make sure that we have all, as we said, upskilled ourselves to ensure that we make really sound decisions on this.
Chair, I wonder if it would be useful for the committee, for all of the new members of staff joining my directorate, I have an induction pack, and within that induction pack, the first 6 pages are dedicated to talking about each of the departments within my directorate and providing an overview of their activity. I'd be delighted to send that through to Megan so that it can be circulated to the committee members. It may just give you that early heads up and a bit of signposting.
I think that would be really useful. I think we can all agree on that, can't we? There was another question from Councillor Jarman. It was on consultation with regard to page 16, item 38. The paper notes that no consultation with users has been conducted, even though we are in year 3 on the transformation plan. Maybe the committee should consider what consultation should be done both to solicit the views of existing users and those of future potential clients in order to inform priorities and to ensure the service remains relevant and attractive to clients. Could you answer that and what your way forward will be? I think, especially with someone coming to do marketing, etc.
The transformation plan was a 2-year plan. It's now ended. There is no year 3. Year 3 for us is business as usual, and I think it's really important to draw that distinction. Consultation was undertaken at the outset of the transformation preparation, and local people were given the opportunity to inform our transformation plans. It wasn't a wide consultation. It was limited in terms of our client and our customer base. Engagement needs to be in relation to people's capacity and working with people to provide feedback. For every person who accesses our service, information is made available as to how they can feedback about the service they receive, whether that's just they have a buzzer in their home that they can use and they never use it, to I once pressed it accidentally when I was doing the washing up and this lady shouted at me from the living room and scared the living daylights out of me, to I had a fall and 2 of your team came round and helped me up into the chair. That feedback loop is absolutely there and something that comes back into the service on a regular basis. For all of the services I support, there are 2 where I receive more contact from people who draw on care and support than any other. White Care is one, and our outreach team providing reablement in people's own home is the other. We don't do widespread consultation as part of our business as usual activity, and that's the phase we're in at the moment. Financial changes form part of the wider council's budget consultations in previous years, and moving forward we'll be relying on that new marketing role to generate interest, potentially holding focus groups to identify what people need from services. The feedback we have from local people who use the services already and the way in which we encourage them to provide feedback will continue to remain. And that's both positive and negative. I'm an unusual person in that I view complaints as being a great opportunity for learning. I will never get upset if somebody complains, because it's only through their feedback that we're able to make a difference and to change the way we do things for the better.
Thank you. This might be a good point, a part of this discussion, to bring in part of the discussion that Laura Gordian and I have had about the way forward for this committee. And at the next meeting of this committee, there will be a report presented that you can all question. It will be a regular report which will come to each committee, which will keep you informed of what's happening. So when a cabinet member would have a lot of data that you would have on a regular basis, it would be not right to just give you just heavily QPR reports and stuff like that. So did you want to explain about the report that we've said that we've come, we think would really be useful for the committee moving forward?
So as I'm sure committee members are aware, the QPMR, the Quarterly Performance Management Report, goes on a quarterly basis to the Policy, Resource and Finance Committee. When Councillor Mosdell and I were having an initial conversation around this committee and the information that I felt it would be appropriate for you to be receiving on a regular basis, I reflected that the QPMR report that comes in September will give you information around April's position. So by that point in time, I'm already 6 months on in terms of managing the directorate, looking at performance, looking at risk and looking at our financial position. I would like this committee to be as informed as you possibly can be when you're making decisions. And I think to be informed, you need access to that information on a regular basis. I'm incredibly fortunate to have been supported by other parts of the council who pull that information together with my ridiculous ask that they make it more readily available for me to bring here on a regular basis. I apologise to Councillor Mosdell. We said every other meeting, not every meeting, because otherwise I'll break the teams who have to manage that element of the report. But you will be receiving at every other meeting starting from July a report that details for you the current performance of adult social care. So that's coming in July. You'll have up to the end of June's performance available to you. The risks as I see them and how we're managing and rating those risks, and also the current up to the end of June financial position. So you'll be able to see how the directorate is performing across all of those areas. What that will do as a committee is hopefully enable you to be as cited as I am on the position for the department. You'll be able to see where we're spending money, how we're spending money and what that looks like, together with the risks that we're carrying, and also how the directorate's performing right across the piece. That won't just relate to adult social care. I wear another hat, my housing hat, that you're not seeing much of in the papers today, but that report will cover off both adult social care and housing in the same level of detail. I'm working with old KPIs. We refreshed them in April. So there was a shift in terms of our risk reporting and our performance reporting in April. But if the committee wished to receive different information, I'd suggest that the next opportunity when I present that report in July, you can let me know and I can go away and see whether it's possible for that information to be collated, or if we're already collating it, to ensure that it's included for you moving forward.
Thank you. Are there any more? I think we've crossed over some lines, but I think it's, this first meeting, there are going to be some lines that we're going to cross with our conversations. Are we happy to move forward with the recommendation? Or let me make sure I'm on the right paper. For the recommendation of this committee, that the committee note and approve the conclusion of the White Care Transformation Plan, which is now busy as usual. Would you mind if I added to that recommendation that we would like as a committee to have this added to the committee's development plan, that we have more training and insight into White Care, and maybe someone come and talk to us about it as well. Would anybody like to second that recommendation? Councillor Lever, should we move to the vote? That motion is passed and we'll move to the next agenda item. Did I get that right, Mr. Guard? I got a smile, must have been right. Lovely. Right, we moved to page 17 to 42, which is a really weird one for me. We did have a conversation, Laura Gordian and I, that actually some of the stuff that's coming here at the moment won't be stuff that's coming in the future, because we did have to have stuff and get a level of understanding what does go on within adult social care. This is the submission of what was spent on 24-25. It's a bit like old news. It's something as a cabinet member, you basically have the sign off, because as you are working forward with the Better Care Fund, and you will as a committee, because you are acting each as like cabinet members, you will have an understanding of what's going on with the Better Care Fund and how it's being spent on a regular basis right up until when it's spent. So we can ask some questions now, but I think we were both agreed, isn't it? It's a bit like, this is old news. It's all been signed off. It was just here really more for information, really. Does anybody have any questions? I do have a question from Councillor Jarman, which I will ask in a second, but I'll bring the committee in first. You can do. Yes, I was just explaining.
Committee members have before them the end of year report for 24-25 in relation to the Better Care Fund. The Better Care Fund is a specific agreement that's in place between the Isle of Wight Council and the Integrated Care Board for the pooling of funding. Central government make available a chunk of money to the ICB that is then passported to the local authority as a mandatory contribution towards adult social care. In addition to that, the ICB put in their own funds and the local authority commit some of their funds to spend on joint priorities. Those joint priorities often include rehabilitation, reablement, recovery, hospital discharge, and for us, the funding across the Adelaide and the Gouldings and the internal services that we deliver. The Better Care Fund is the purview of the Health and Wellbeing Board. Nationally, the Health and Wellbeing Board are required to sign off the plans, to sign off the quarterly returns and to sign off the end of year report. And that is a process that's been in place as part of the statute that governs that programme. Historically, as Councillor Mosdell said, we, out of courtesy, share with the Cabinet member the reports that are going to the Health and Wellbeing Board before they go. And it's as that matter of courtesy, this report is with you today. The committee are not asked to endorse it, to sign it off, or even to note it, because the Health and Wellbeing Board are responsible for all of that. But by way of background, it provides you with a bit of information which shows you the relationship between the local authority and the Integrated Care Board. Following on from the first presentation, the Better Care Fund will be impacted by the ICB blueprint. The extent of that impact, we're not clear at this stage. And nationally, there is a review of the Better Care Fund that's being undertaken, which could see it all completely change from 2026. So whilst I'd be very happy to talk you through in detail what it is and how it operates, I suspect that I don't know enough to give you any assurance to what that will look like from April 2026 at this stage, because those decisions haven't been made by central government yet.
Does anybody have any questions? That was your question. The question from Councillor Jarman was hospital discharges. This has been a contentious issue for some time, both in relation to discharge plans and also funding of the same. The paper does not cover this in detail on the ongoing cost of the Isle of Wight Council or the consequences of bed blotting that matters leaves unresolved. This was raised at the State of the Island presentation and debated at the Riverside Centre last week without resolution or evidence of an integrated plan. Figures were presented on behalf of St Mary's accreditation programme, such as example for QSF as a comprehensive framework that sets standards for tech services and etc. So it's basically, there isn't that much detail about bed, etc.
Thank you, Chair. I find the term bed blocking to be hugely offensive. We are talking about people who have, through some crisis, ended up in a hospital receiving acute care to meet their needs. We also don't talk about discharge anymore. We talk about transfer of care, because the people are inevitably going from one place where they're receiving care and support to another place where they're receiving care and support when their medical condition reaches a stage that it's appropriate for them to do that. The Better Care Fund was boosted by some discharge funding to support NHS agendas around flow through acute settings. This paper does not provide detail in relation to that, because that detail was contained in the original plan. This is simply the end of year report showing that those discharge funds were spent in full in accordance with the grant conditions with which they were received. I can confirm that the local authorities discharge fund and the ICB discharge fund, you'll find them in paragraph 13, the bottom two lines on the table, were spent in full on discharge activity to support flow through the acute hospital and the transfer of vulnerable people to alternative care and support provisions, or in the majority of cases, back to the place that they called home, which is the aim of both the local authority and of the NHS.
Thank you. Do we have any questions at all on the BCF, on Better Care Fund? Okay, so if you could look. It's okay.
Sorry, thank you, Chair. I'm just picking up on the Better Care Fund. There's an item in there that I just don't see is relevant to it at all. and it's this section on responding to climate change and enhancing the biosphere. I've just read that and I look at the graph and with the greatest respect, I just think it's irrelevant. People, we're after the care. The care, we're obviously trying to provide the best care in the most direct route. And I just don't see that in there. Someone somewhere has spent time on there. And I don't want to seem rude, Claire, because obviously I'm interested in protecting the planet like anyone, but I just don't see that is relevant in what we're talking about here. And I think it's something that could just be omitted
I agree.
and could save money
I agree.
and time.
So everyone's smiling around the room because everyone sort of agrees that it is, but I think it's better that an officer responds to that. I think it has to come from Mr. Guard, because I think you can toss a coin to whoever answers it if you want. I think it's a legal thingy that it has to be in there. Who wants to answer it?
Thank you, Chair. Very happy to take that back. It's a corporate decision. I think led by a resolution from full council some time ago to include some points around the climate and biosphere in the report. I'm very happy to take that back. We have a meeting called Call Over that looks at all of these reports before they're published and go to committees. I'm very happy to take that back to that working group to just say, look, do we need to include that on every single report? So I'll take that back, Councillor Adams.
I don't want to come across as rude or, because I care deeply about the climate, but I just think in some circumstances, some of this stuff, Ben, it's just not relevant. It's just in there. It just don't seem to me that it's relevant. Thank you.
Yes, you may.
And I know, but I hope I'm going to be helpful in my next comment. This is a discussion that's taken place at corporate management team with directors, and I believe that there will be some flexibility moving forward in relation to expectations around certain sections of the report, other sections as well that historically have always been mandated to be completed may be removed where they're not of great relevance to the matter that's being discussed in the report. So I know that from our chief executive, there is a real clear direction that we work to make these reports as meaningful as possible for committees, and that may include the removal of information where it doesn't add to the material that you're being asked to consider.
Are we happy to move to, I've got to go find the recommendation, to the recommendation on page 17 that the Adult Social Care, Public Health and Housing Needs Committee notes the BCF 2024 end of year submission, and I look for a seconder. Councillor Redrop, can we move to the vote, please? Thank you. We will take that motion as passed and move to the next agenda item, which is the Isle of Wight Dementia Strategy, pages 43 to 180. And I once again pass over to Laura Gordon, our director.
Thank you, Chair, and I hope you're not bored of me yet. 3 reports is quite a lot in one meeting, isn't it? For the island, we know dementia is a topic that brings forward lots of different feelings for lots of different people. We know that feeling and the views of our community drove us to develop a whole island-wide dementia strategy, and a copy of that strategy was provided to you along with the report. That strategy was launched in May 2022 and has now just come up for its 3rd year. Reviews of that strategy have been presented to your predecessors in year 1, year 2 and the year 3 report is currently in development. The strategy itself is due to be revised, to be refreshed, and consultation with our communities is commencing in that area to ensure that we know how far we've travelled since the original strategy and how far we've got to go. What we know from those really early conversations there are some real core successes that have been delivered as a result of the strategy, and I'd point to Parklands, the Dementia Hub in Cowes, as one of those real key delivery areas that have impacted for local people. We know we've still got a distance to go, and that distance to go is where we're focusing now. The report's purpose is to provide you with an overview of where we are, of some of those successes and of some of those areas that still require development, but predominantly to ask for your agreement that the council can continue to support this work. It's my team who lead on that strategy development. It's my team who lead on the engagement with the communities and who have the brilliant job of having to pull everything together all of the time. So it is a council resource that supports that island-wide strategy delivery. For me, it's incredibly important. For the island, we've heard how incredibly important it is, and I hope that its importance is something that's recognised by the committee today, and you feel able to agree to our ongoing support of that strategy and its further development.
Thank you. If we can note that this is, the recommendation is that the continued support, basically. Does anybody have any questions? Councillor Lee.
Thank you, Chair. I've got no problem with continuing. I just out of curiosity, where it talks about the significant implications, risks, option 2 talks about the capacity of all partners to undertake the work required to develop separate strategies. Sorry if I've missed it in the report, but is there a view of those partners and where they are with those strategies, so we can get a bit of a broader view of where that risk may lie moving forward? Is that possible?
There isn't as much detail in the report as perhaps you or I would have hoped for, and for that I apologise. But in terms of capacity, with the changes we're seeing at the ICB, with the separation we've seen in the NHS Trust from a single trust for the whole of the island for acute, ambulance, community and mental health to two separate trusts, the engagement through development of the strategy has changed. We don't know what the ICB will be able to commit in terms of staffing and support moving forward, and we're still waiting for the position for our 2 island trusts to shake down, and that's led to some gaps. Those gaps are explored regularly at our dementia steering group, which meets every other month with community partners, independent sector partners, the Alzheimer's Cafe Isle of Wight, the Dementia Awareness Partnership, and all of our statutory partners as well. And currently, that pressure is really being felt in terms of delivery. I'm optimistic that that will change, but it continues to be a risk and one that we're very aware of.
Thank you. Can I just have a little bit further on that question? Going back to the first part of this meeting, seeing that the ICB, their running costs being reduced by 50% and a real quick turnaround of December, having worked quite a lot on these strategies and worked closely with yourself and the previous director, their input was quite large. I can only see this having, not just this strategy, but other strategies, quite a big impact on your workload and other people's workloads, because reducing running costs of other areas, you know, I know some really good people who work within the ICB who are unlikely to be there in the future with the changes that they're talking about. I am greatly concerned. I said at the very beginning, and I still sit here as further we go through the meeting, of what this is going to cause. This is just a perfect example of how those changes are going to impact our strategy. Do you sort of agree with that, and could you enlarge on it?
I think in relation to this specific strategy, I'm less concerned about input. Over the 3-year life of the strategy we have, the lion's share of support has come from local voluntary sector partners. They're closest to the people and are able to really work with them to ensure that the strategy reflects what they know. For a local authority, for an ICB going in and asking a load of questions, you're meeting that person for the first time. It's the people who are closest to them who can add more value in that space. So for this specific strategy, I'm perhaps not as concerned as I would have been 4 years ago when we were starting this piece of work. Our colleagues in the ICB continue to be present, they continue to support, and our clinical director, Michelle Legg, is very engaged in this piece of work and continues to be. More widely, other strategies and other delivery does worry me. If we're looking at a 50% reduction in office functions, potentially that means 1 in 2 people may lose their jobs at the ICB. And at this stage, I think compassion and kindness is the space we all need to occupy. our colleagues who we've worked with really closely are going through a period of great uncertainty. Me adding on my worries about whether or not they're going to be there to support a strategy moving forward will not be helpful at all. And what we need to do is support the ICB to go through this huge organisational change. And I think we need to not lose sight of the fact that last year they went through a similar change and their number reduced by 30%. So this is on top of already having gone through a number of change programmes over a very short period of time. I remain committed to supporting the ICB and to supporting their staff in any way I can. I think the partnership working we've had with the ICB and we continue to have with the ICB at a local level is as strong as it's ever been. And I meet on a regular basis with local ICB colleagues to talk about all manner of things and to work out how we can move things forward together in the best possible way. We're really lucky to have such a vibrant voluntary sector supporting both of us in this space, but also our independent sector, who through the Isle of Wight Care Partnership are able to also add support to moving forward health and care conversations for us as an island more widely.
Do we have any further questions on this part of the agenda? Councillor.
Sorry, I'm assuming with these redundancies, people going, or the reduction in staff, what my concern is there is your workload isn't reducing. So in any shape or form, is it? It's, you know, that's a fair comment, yeah? Is it also a fair comment to say that some of these jobs that are going, are they going to be replaced by artificial intelligence or chatbots or whatever? Is there something happening on the admin side that is going to, you know, I'm not a techie by the way, but
Councillor Adams, I think the short answer to that is I don't know. It's not my organisation. So I don't know what the plans of the ICB are in terms of deploying AI to support them. I know that in my own directorate, we are utilising AI. We're utilising Copilot to support our staff. And we've just had a really successful pilot of an application called Magic Notes. And I'm going off on a tangent, Chair. Please kick me back into touch if you need to. Magic Notes is basically AI that supports all of my social work team. Whereas before, they used to have to go and meet with somebody, undertake their assessment, go back to the office, fill in multiple forms, check it with the person and go backwards and forwards. What Magic Notes pretty much does is that admin work for them. So my social workers are reporting a 30 to 50% reduction in the time that they need to be doing administrative work. What that means is that 30 to 50% of time can now be deployed doing face-to-face social work, supporting our most vulnerable folk at the time they need that support. There are multiple checks and balances in place to assure quality, to ensure privacy, and to make sure that actually there is no detrimental impact of deploying technology in that way. And through our 6-month pilot, we were really impressed with the results. We've come to the end of the pilot. We're going through our procurement process because it is a tool that we're looking to put in place permanently for the directorate moving forward. Those social workers who've had access to that tool who suddenly don't are furious with me. They really have noticed the gap that it's left in terms of their working practices and can't wait to have it back so that they can be doing more social work. And ultimately, that's why they came into the business. They didn't come into the business to be writing 3 or 4 reports about the same thing over and over again. So we need to really support with that streamlining. For me, AI, technology, digital solutions offer the opportunity to do things differently, not instead of. And I'm really keen that we ensure that I've got the right person doing the right task at the right time. Wasted effort or the wrong person doing the task simply dilutes our resources, and we know our resources are really scarce. For me, my biggest resource and my best resource is my people, so making sure I deploy them in the right way to have maximum impact for island residents is absolutely critical. I don't know what the position for the ICB is. I suggest there may be colleagues at the ICB who may still be online who would be happy to respond to that for you, or I'd be happy to take that question back to them and ask them on your behalf.
I just found, so the other thing was with my recent experience with our neighbour, the front facing staff, the staff out on the coal face as such, with that contact is very important, and that time spent with them, that it's really, really important because it builds that relationship, the trust. Just the assistance they're getting in to build that trust. I think that's invaluable, and that come across. And the staff, I think they was good. They was fantastic. As I say, there were some small problems with it, which I won't mention here, but I will talk to you about that after. But it was just little things, but the care really was good, and it's invaluable. We can't afford to lose those staff on the front line. If something goes further down the line, I can see what you're saying with regards to notes and setting up the things, but we really need to keep the front line staff.
Councillor, I think I completely agree, and I think one of the things that the committee can keep an eye on is actually that AI is being used in the right reasons to actually assist to actually keep those staff. And it's like Laura Gordian was saying, it's made their time better and well spent if they can get a piece of kit that will actually help them fill in forms. Then social workers are actually doing frontline stuff and the stuff they should just do. And I think as a committee we should actually keep a watchful eye that basis, that's what any type of new technology is being used for, that it's making that personal contact one-to-one allow more time, because we're using the right pieces of technology to make sure that that time is well spent. So we move to the recommendation on page 43 that the committee approve the council's continued support for and involvement in the delivery of the system-wide Isle of Wight dementia strategy, and I look for a seconder. Councillor Redrup, can we all move to the vote, please? I've passed that motion as carried, and we move on to the next part, which the committee work plan 203 to 204. I think, having spoken to Simon Bryan and to Laura Gordian, this is definitely a work in progress at the moment, where the committee finds its feet, and there will be stuff that will come, and there will be some real meaty decisions that we've got to make. But there's also lots of stuff that we know we can't let fall between the gaps. So we have had a discussion that came out the previous Adult Social Care Committee regarding children's health, mental health services. Because we put the ICB on here today, we didn't have this on this agenda. So I think what we'll do is move forward, if that's okay with everybody, that I pick out an email and say, which do you feel is priority of different strategies and stuff that we need to look at as part of this as well. For example, Councillor Redrup and I have discussed the domestic violence strategy. We all said in the last committees that it wasn't fit for purpose. We need to make sure that stuff like that doesn't get lost along the way. So I'm not sure how we can best work forward with that. Whether it's worth me as chair sending a list of items, having my meeting tomorrow with Laura, and I'll have a meeting with Simon Bryan and send some ideas through to you and ask you what do you think, and maybe a number chart that says where do you put this on your priorities at the moment, and then as a committee we can bring each of those forward to make sure that nothing gets missed. Is that okay? Yeah, is that a good way of working forward? That allows me to work with Laura and with Simon, or the new director Kate when she arrives, to ensure that we're making sure that this committee is meaningful and getting really involved in strategies and everything that is so important to this running of this council. Does anybody have any questions regarding the current work plan as it is? Any questions from Laura now?
I just wanted to kind of take the opportunity to point out that the committee does kind of have two hats to it. There is the health scrutiny side of things as well as the decision making. As you will see on the work plan, the health scrutiny topics have a TBC next to them. So if there are specific items that you would like to look at moving forward externally, like we had the ICB come in this evening, I would be grateful if you could put some thought into that.
That was part of what I was going to do, was tomorrow send out on the group email, to send out a list of things that I think should come to this committee that brings in outside bodies. Top of the head, things like dentistry, update on where we are with dentistry and getting outside bodies in, those types of items. I will send a list through tomorrow and just do a little, where do we think of priorities on those meaty topics that we need to get to grips, that does involve outside bodies that we would have brought in at a health scrutiny. we also need to make sure that we're covering things in the right committees. I did speak to Councillor Rading regarding the issue that come up at Councillor Redrutt's previous position as chair of Adult Social Care Scrutiny Committee was the Children Mental Health Services. We did think maybe, I'll put this in an email tomorrow for everyone to give their opinions, was whether that should sit better for a discussion within the Health and Wellbeing Board, where Children's Services representation and this board's representation will be at, because it covers both committees. But if I could put that through, I would really appreciate if everybody could get back to me with your opinions, so that we can make sure that when we get to the July meeting, we have a really well-informed agenda, and we have, when we bring outside bodies in, it's something that all the committee, you know, want to actually discuss. There is lots to do in the next year, so we need to make sure that we cover it. Would that be satisfying? Would that help, Mel? So we'll get by Monday, when we have our meeting on Monday, we'll definitely have what from this committee, what we feel the outside body should be and presenting. So if you could all put your thinking caps on as well, when the email comes out tomorrow, and Sarah, maybe we could have a quick catch up on that as well. Is that okay with everybody? One last thing, can we make sure when I'm sending the press releases out, that you are watching your emails, that you can just ping back an email saying no comment? That would be really useful. There are some press releases that come through that have quite tight deadlines that a cabinet member would have just been able to sign off. I am trying to make sure that this committee is as involved as we possibly all can be, but that needs us all working together and just pinging back an email. If it gets to the deadline that I've set, then you have to accept that press release will have to go without someone's comments. So please, that email, that joint group email, is really important that you keep an eye on if possible and get back. Otherwise, we can't take on board people's comments. Is that right? Has anybody else got anything else they'd like to raise before? No? Waving your hand, Mr. Guard, at me.
Sorry, it was just,
Mr. Lever.
I'm just trying to find my feet around subject matter that may not warrant being on the work plan, essentially, but how do we, wanting a discussion as a committee about how we might move that conversation forward with officers. I'm just wondering how best to do that.
I think at the moment, I think the best way would be using that group email. You know, Dem Services officers have sent it up, and actually if we watch those emails, it's a really good way of getting and opening up a conversation that is with us, and actually it will open up that conversation where we can then think, you know, this is a really important issue. It does take outside bodies. Let's put it on the next meeting as the scrutiny section of that agenda. So I think, you know, the more input that we can have as a committee to work as one would be really important. You know, we have to remember we are acting. There is no cabinet member anymore. It's down to us. So we do need to make sure that we are asking those questions. And then I can feed back to officers. Laura Gordon.
Chair, I'm very conscious that as a committee, the scrutiny function will largely be a health scrutiny function, not a social care, housing or public health scrutiny function. And it may be that the questions the committee have relate not to decisions that need to be made, which will come to the committee, but to, I'll call it business as usual activity within the two directorates. I will speak for Simon because I feel that I'm able to at this point. We'd be really happy to engage with the committee around informal briefings. If there are areas you want to know more about, things you've heard about and you'd like to be updated about whilst not directly being the business of the committee, I'd be delighted to accommodate those informal briefings. And if the committee wanted one of those on a monthly basis or a bi-monthly basis for you to determine the agenda at those informal briefings, I know Simon and I will be very happy to accommodate them. And we can set it up as an expectation for Kate. She wouldn't know any different.
I think we also have to remember what we've been really light on the discussion here this evening, and it's one of the most important elements of this committee, is housing and what that embraces. You know, we know it's one of the most important issues on the island. There is lots of stuff going on at the moment within social media regarding refugee houses and stuff like that. it's your responsibility as a committee for us to be able to ask those questions, if not informally on the email chain, to find out exactly what positions are with stuff. We need to make sure on the next committee that we do have items on there regarding housing. I think it's really important and something that we really need to, you know, keep focused on as well as part of this committee. This was the first meeting, and I think, you know, we did well to get an agenda together because we are finding our feet. But we've had that now. There is nothing that will drive me more insane when I get people who have been 3 years as a councillor and say, well, I wasn't aware of that. And I think, well, where have you been for the last 3 years? You know, we want to get, this is the first meeting that, you know, we weren't quite sure how it was going to run, but I think now we've got a fair idea of how we're all going to work together. And we need to make sure that we work really strongly together and make sure that this committee is really, really meaningful. Is that right? Sarah, have you got anything to add?
Yeah, I just wanted to suggest that perhaps it might be a good idea as part of the committee training that we're working on, that having sort of an introduction or an overview or refresher on the housing provision that the council provides, and where we're at with that. Yeah, thank you.
If everybody's happy, I'll send an email around tomorrow morning asking, you know, what your opinions are, what do you think, you know, questions should be raised of outside bodies, who you'd like to see here. And then I'll have my regular meeting with Laura Gordian so that we can make sure that we make this really important. And if you think of anything, ping us all an email. You know, it might be something you think you'll wait until the next meeting, but July and actually in this portfolio is a really long time. You know, lots happen, so can we all make sure that we really regularly communicate, please, and not just wait for these meetings, if that's okay. Thank you everybody for your time this evening, really appreciated. For those of you who are going to the festival, enjoy. And I hope you all get home safely, because I think the traffic might be a little bit of a nightmare out there at the moment. Thank you, and I'll see you, I'll be you all an email tomorrow. And is everybody else happy for the meeting to now close? Yes.